Caring for adults with disabilities can be a challenging job. If it takes place in an institution, it can also be very expensive. That's one reason for considering another option, adult foster care. To help explain that option, Central Boston Elder Services will hold an event April 4th at its office in Roxbury. To tell us about the program and the event are two guests from the agency, the Elder Foster Care Program Manager, Jems, Melay, and the Director of Long-Term Support Services, Mila Spitkosky. Thank you both for being with us.
Thank you.
I want to start with Jems because people might get a little confused here. Is this foster care? Does that mean we're taking in somebody we don't know? What is this exactly?
Adult foster care is a program designed for the elderly population, as well as individuals aged 16 or older with a physical or mental disability. Primarily, they need to have a trained caregiver and a qualified setting. And the caregiver essentially will provide the necessary care to them, which is personal care, daily care needs, such as bathing, dressing, eating, and transportation as needed. In addition, the caregiver is provided with a tax-free stipend, and then for the services rendered to this individual.
Mila, what about the caregivers? Are these usually relatives or at least friends of the people who are in foster care?
In most cases, yes, it can be relatives, it can be kids. The only people who cannot be caregivers are people who are legally responsible for these elders or young people with disabilities.
Now, it's not unusual for a multi-generation family to have an elderly relative living with them, but what's the difference between that kind of normal arrangement and what goes on in foster care?
Actually, the whole goal of adult foster care program is to make it no difference. We want to make sure that people who need care stay with their loved ones in their home, in a caring and warm environment.
Okay. Jems, what about the training? You mentioned that people do get some of that. What kind of things do they usually need to learn that they don't already know?
Well, adult foster care provide a vast amount of training to the caregivers so that they can provide quality care for the member. We have training pertaining to fire evacuation plan, universal precaution. We have protective abuse and neglect, how to make a report. We have training on family integration, cultural sensitivity, a long list of services. We have approximately 12 training modules, which we actually cover in order to guide the caregiver in providing the quality care they need to provide.
Mila, the Central Boston Elder Services has been offering this program for a while so far. Anything you've heard about how this is working out for people?
Actually, we got very positive feedback. Our program just growing, and we don't have as many members as some other programs in Massachusetts that have been around forever, but our clients very happy, and Jems and our nurses provide excellent care. So.
Jems, when people choose this option, what's the reason usually?
Well, the reason is that people feel a lot more comfortable being in a home setting instead of going to a long-term care facility. In addition, what people don't realize, it's a lot cheaper for the taxpayers, for members to remain at home than going to long-term care. When you are in a home setting, essentially, you still have your independence. You also still have the ability to remain integrated in the community.
By the way, I know you say this saves money for taxpayers, but what about the families? Because, I mean, it's not always just easy to drive somebody up to long-term care and have somebody pay for it.
Well, it's beneficial all across the board, not just for the taxpayers, but also for the member as well.
Mila, I know this is good for the adults who are in foster care, but what about the people who are caring for them? Do they say they get something from this other than the stipend?
Again, if you have your family member and you have to make a choice between letting this family member go to a facility. And I've been in business for almost 20 years. I never met anyone who wants to live in a long-term care facility. People want to be at home, and family members, they, other than money, they get their time with their loved ones at home. They see their loved ones, and it's not always elderly. Sometimes it's a young adults. They may be 16 years of age, and you want to see your kid living as comfortable as possible in a lovely environment with the care they need and deserve.
It also occurs to me that in many cases here in Boston, we might have immigrant families who, if they sent that elderly relative to an institution, there would be nobody they could talk to. So,
Yes. Yeah, it's all part of people's choice and quality of care. So we want to make sure that people who need long-term support services get them in the environment they choose to, and there's nothing better than your own home.
Jems, anything you can tell us about the event that's happening this week to describe this program?
The event is actually taking place. It's an open house that we're having on the 4th between the hours of 10 a.m. to 2 p.m. We welcome anyone in the community who wants to know more about the program and who has a family member that can benefit from this program. In addition, we also, if you want to be a caregiver, we can provide you with some information pertaining to how the program works.
And you got a website with some more details too?
Yes, we do have a website. You can go to www.centralboston.org, www.centralboston.org, and you can also contact us at 617-277-7416.
Thank you both very much.
Thank you.
Thank you, Chris.
Jems Melay and Mila Spitkosky.